Good morning, friends. Today we will talk about one of the important topics in Kaumarpratya or Ayurveda pediatrics, that is clinical understanding and management of nocturnal enuresis or Shayya mutra. In this class, we shall see some of the important aspects related to nocturnal enuresis and how it is correlated with the Shayya mutra, which is explained in Ayurvedic classics with its management. Word enuresis is derived from a Greek word, evope, which means to void the urine. According to Liddell and Scott's Greek lexicon, the meaning is to make the water. There is a society called as International Children Continence Society. It is also called as ICCS. According to this society, enuresis only refers to the nocturnal enuresis and it should not refer to any other form of urinary incontinence. Urinary incontinence may occur because of various reasons. What I mean to say is, according to ICCS, whenever we say nocturnal enuresis, it is only refers to nighttime enuresis and not related to any other form of enuresis. ICCS divides the enuresis into two forms, primary and secondary. This division is based on the concept that whether the child experiences a minimum of 6 months of period of incontinence before the onset of the enuresis. That means if there is a 6 month of dry nights and afterwards again the enuresis started, nocturnal enuresis started, then it is called as secondary, and it is continuous, then it is called as primary. Now the prevalent age of the Shayya mutra or nocturnal enuresis will vary. The most prevalent age is at the 5 years. In 5 years, usually 7% of the male and 3% of the females are get affected. At the age of 10, 3% of male and 2% of the females are affected, and at the age of 18, 1% of male, and it is very rare in female. That means that as the age advances, the incidence of this nocturnal enuresis goes on decreasing. Meantime, it is less common in female compared to male. Similarly, in the general population, the study shows that 2.5% of the enuretic in the age group of 0 to 10 years. That means most prevalent age is 0 to 10 years, and during 0 to 10 years, about 2.5% are enuretic. This information is given from Lal and Sethi in 1977. There is normal variation in dry at night. Different children will be dry at night. When I say dry at night means baby is not passing urine at night hours. Okay? So baby is not bedwetting at night hours. So now the normal variation will be seen there. Usually at the age of 2 years, 25% of the children are dry by daytime and 10% will be dry by night time. At the age of 2.5 years, 85% will be dry by the daytime and 48% will be dry by the night time. At the age of 3 years, 98% of the children are dry by daytime and 78% will be dry by night time. What is the age of bladder control in a growing child? Now this is very important. The prevalence of enuresis varies with the age, sex, and also with the geographical variations. This is quite common in boys compared to the girls, and most common age is 7 to 10 years. By 12 months, there is no bladder control at all. You take female baby, male baby at 1 year of age of development, there is no bladder control at all. Baby passes urine in the daytime also, involuntarily, and baby passes the urine in the night hours also. Little control is attained by 12 to 18 months. Little control will be attained by 12 to 18 months. And most of the children get bladder control only after 24 to 30 months. This is the average, 24 to after 2 years, 2 to 2.5 years. So child usually get the bladder control. For most of the children it is true. So average age is 27 months. You can take the average month of attaining the bladder control, night time and as well as daytime, it is 27 months. Now in this condition, in this situation, if you go for proper toilet training of the baby, it helps to attain the same in a faster. It may be attained at 2 years also, and if the parents are very much keen and they are giving good toilet training. What do you mean by toilet training? That we will discuss. 90% will attain daytime control by 5 years, and nighttime control takes a long time. Okay, 90% of the babies will have a daytime urine control by 5 years, but nighttime control may take some long time. Girls tend to train faster than the boys. This is the incidence shows. Okay, the report says that girls tends to train faster than the boys as far as toilet training is considered. Normal up to 4 years for the girls and 5 years for the boys. The normal age for attaining the bladder control for the girls is 4 years, but the same is for boys, it is 5 years. So enuresis is involuntary passage of urine by child beyond an age when they would have toilet training and control. So what is the exact definition of enuresis? Enuresis is nothing but it is involuntary passage of the urine by the child beyond an age. By that age, we are expecting that child has to get the control over bladder control. But beyond that age, when they would have passed, or beyond that age also when they are passing the urine involuntarily, then it is called as enuresis. Now, what are the muscles which are involved in the process of urination? Because the voluntary and involuntary muscles which are involved in the process of urination is very important as far as enuresis is concerned. Once the baby has good control over these muscles, when the tonicity of these muscles increases, then only the bladder control is possible. Now, for the urination purpose, voiding is a complex activity and of the bladder, which is a balloon-like structure, which is present in the lowest part of the abdomen that we know. There are two types of muscles. One is a destressor muscles. Destressor muscles which is present in the bladder, so that stores the urine and squeeze and empty the bladder. Another group of the muscle is sphincter group of muscles. Sphincter group of the muscles stay contracted to hold the urine and automatically relax when destressor contracts. When destressor muscles contract, the sphincter group of muscles relax. When sphincters contract, usually destressor group of the muscles will be relaxed condition and they are storing the urine. There is another set of the muscles which is important for the urine control, that is pelvic floor muscles. They also prevent the backflow. So these muscles, pelvic floor muscles, they prevent the backflow of the urine. So we have got destressor group of muscles, sphincter group of muscles, and as well as the pelvic floor muscles, which play important role in urination and controlling of urine. Nocturnal enuresis is nothing but a normal urinary bladder emptying at a wrong place at a time at least twice in a month after the age of 5 years. After the age of 5 years. So normal urinary bladder emptying at a wrong place and time at least twice a month after the age of 5 years is called as nocturnal enuresis. Involuntary voiding of the urine at night after the age of 5 years is also called as nocturnal enuresis. These are the different definitions. Fairly common in pediatric practice. The potential causes of embarrassment to the child as well as parents. This is also a potential cause of embarrassment for the child and as well as also parents when the child passes urine at a wrong place and a wrong time. So few may also wet the garments during the walking hours also. That means some of the children also wet the garment during the waking. That's the daytime also. It's called as diurnal enuresis. This is called as diurnal enuresis. So in these slides we have seen what do you mean by nocturnal enuresis. It is normal urinary bladder emptying at a wrong place and a time at least twice a month after the age of 5 years. This is the criteria. At least in a month there should be such reports from the parents at least for 2 times. Okay. So at one place child has passed urine once and there is afterwards child is absolutely fine. So this is not considered as nocturnal enuresis. At least in a 30 days of time, at least there are 2 incidents of such nocturnal enuresis, then only it should be seriously taken. Okay. So involuntary voiding of the urine at night after the age of 5 years is always considered as pathological. Okay. Of course, it's quite common in boys. It's always considered as pathological and it should be considered as Shayya mutra or nocturnal enuresis. Okay. So now, sometime babies also pass, children also passes or wet their garment during the daytime. That is not called as nocturnal enuresis, it is called as diurnal enuresis. Now these are the DSM criteria for the diagnosis. The repeated voiding of the urine into the bed or clothes, involuntary or intentional. The behavior must be clinically significant as manifested by either a frequency of twice a week for at least 3 consecutive months, or the presence of clinically significant distress or impairment in the social, academic, or occupational life, or other important areas of functioning. This is what DSM-5 criteria says. Then only you will consider it as enuresis. Second criteria is a chronological age of at least 5 years. Before 5 years, if nocturnal enuresis is there, you cannot say it as nocturnal enuresis. The behavior is not due to exclusively to direct physiological effect of a substance like diuretic, antipsychotic, or selective serotonin reuptakes inhibitors, or due to incontinence, uncured incontinence as a result of polyuria or during the loss of consciousness. And these symptoms must not be due to general medical condition. This is the DSM criteria to say that any condition as nocturnal enuresis. Now, in case of nocturnal enuresis, family history is very important. In 50% of the cases, you will get the positive family history. What do you mean by family history here? You find either the parents, mother or father, or somebody in the family will have the strong history of nocturnal enuresis in their childhood. If one parent has got nocturnal enuresis, then the upcoming child has got 44% of risk of developing nocturnal enuresis. If the both parents are affected by nocturnal enuresis during their childhood time, the child has 77% of risk. So family history is a very important because it is transmitted by autosomal dominant fashion. Okay, so that is generation skipping will not be there. Each generation it will be there. So this type of this tendency will be passed as an autosomal dominant type of fashion. So you take a family history generation wise, then the things will be very clear. Ask about the age of resolution of the symptoms in the parents. When in parents, at what age it was stopped, okay, which helps in the treatment. Almost all same thing will happen in the baby also, child also. So usually I told that it is autosomal dominant fashion of tendency, and chromosome number 22 is identified as a site of enuresis, Danish family. Okay, it belongs to Danish family. Other chromosomes involved are 8, 12 and 16, because as we are telling that it is transmitted by a familial tendency will be there. Family history will be always positive in most of the conditions. So it is transmitted through or inherited through the autosomal dominant fashion. It's not exactly a disease, but this particular tendency is transmitted through autosomal dominant fashion. These are the chromosomes which are commonly involved. Chromosome number 22, autosomes, then 8, 12 and 16. Now what do you mean by primary enuresis? Primary enuresis is one such condition where genetic pattern will be seen. It is mostly because of genetic factors. Okay, 45% in families with one parent enuretic. The primary enuresis, in 45% of the cases, the families with one parents are enuretic, either mother or father. In 15%, neither of the parents are enuretic. We will also get this condition also. In 15% of the patient, none of the parents are having a strong positive history, family history, but still child is having enuresis. This is also possible in 15% of cases. 68% of the cases, concordance rate in the monozygotic twins and 38% of rate in dizygotic twins. So genes on the chromosome is 22 is implicated, as we know. Now what are the mechanisms? Mechanism of primary enuresis is abnormal bladder function. There will be bladder function abnormality. There is hyposecretion of the arginine vasopressin hormone secretion. Then diminished capacity to be aroused from the sleep, and maybe in the day or night. These are the different mechanisms which are involved in primary enuresis. Either there is an abnormal bladder functioning, or there is a less secretion of a hormone called as arginine vasopressin, which is directly related to the urine production and passage. And there is also diminished capacity to be aroused from the sleep. So child is passing the urine in the sleep itself, isn't it? So when the bladder is full, child is not able to get up, and that arousal that is disturbed. Okay, so this may sometimes happens in the daytime. If the baby is sleeping in the daytime also it can pass. Okay, if the baby is sleeping in the nighttime it pass. So this may happens in the daytime or nighttime both. The primary type is also called as persistent type. Okay, the primary type which we are discussing, it's also called as primary, is also called as persistent type. What is the basic characteristic feature of primary or persistent type of enuresis? Is child is never dry at night. That means, now suppose the child is 6 years old or 7 years old, the complaint of the parent is, since birth, child is never dry at night. Every night he is passing. So this type of presentation is always suggestive of primary type or persistent type of enuresis. Enuresis in the child who has never established a urine continence for more than 6 months. Okay, so that is called as persistent types. That means he is passing the urine every day and he never controlled it. He never got control over the urine passage. Okay, so there is erratic bladder training. So what are the common causes for this? Either erratic bladder training, either by the parents who are over anxious or prompt control. So this type of primary problem, one is family history we have discussed. That's the family tendency will be there, therefore it is coming. Second is when the parents are over anxious and they are very, very erratic. That means they are erratically trying to give the bladder training. That means from the day one itself, baby 6 month old, baby 7 month old, they are going for bladder control and they are thinking that they are doing a very good toilet training to the giving very good toilet training to the baby, but actually it was not the right age to do so. So that's called as erratic bladder training. That means not according to the age and situation they are giving, or either they are very anxious. So that creates confusion in the mind of the baby, and baby may pass at any time. Okay, so those who are not reasonably close to the child needs. Another important cause for the primary or persistent type is either the parents or caregivers, they are not very close to the child's needs. They are not able to understand when the child is going to pass. Usually it is expected immediately after getting from the sleep, usually child passes, but they are not responding for such things. They are not taking the baby immediately to the bathroom immediately after getting from the sleep. So that means those who are not reasonably close to the child's needs, usually after taking food baby can pass the urine. So that time you have to take the baby to the bathroom. This is proper toilet training. Or immediately after getting up from the sleep, so baby usually passes. That time you have to take place. Okay, or you have to understand the body language of the child. Sometimes the baby touches the urinary area, touches the pubic area like that. Okay, or sometimes there is erection of the penis in case of males. So this point we have to understand, and accordingly we have to behave. Sometimes parents fail to do this, and that is also one of the cause of the persistent type. That means very over anxious parents, they indulge in the toilet training too much. Okay, that create confusion in the baby. Okay, so this is one thing. 75% belongs to this type. 75% of the enuretic children, which we have seen in the clinical practice, so they belongs to this persistent or primary type. Okay, so in short, in nutshell, we can say that the persistent type of the enuresis is most commonly due to inappropriate toilet training. Either you are starting the toilet training too early or too late, or you are doing it in an erratic way. Number 2, congenital problems of the urinary tract. Suppose a child is suffering from some of the congenital problems of the urinary tract, then also child is more likely to have persistent type of primary, or structural problems in the urinary tract is there, and that is the cause. And these are the two important things. Now, prognosis depends upon the underlying cause. If the structural cause or congenital anomaly is the cause of this primary type of enuresis, then the underlying cause should be treated. If it is erratic training, toilet training with the parents, or over anxious parents, or inappropriate training, then toilet training has to be given to correct this problem. Etiological factors for the primary nocturnal enuresis. If you see, what are the etiological factors of the primary nocturnal enuresis? Disorders of the sleep, small bladder size, genetic disposition, improper toilet training, low socio-economical status, mental subnormality, So these are some of the etiological factors of the primary nocturnal enuresis. We will discuss one by one in the later part. There may be sometimes only the disorders related to the sleep. Okay, child is not able to get up. Okay, child is not getting that response, bladderful response. That's the sign. That's the problem. Second one is small bladder size. Bladder size itself is very small, and small accumulation of the urine, little accumulation of urine also stimulates the process of urination. Third one is genetic disposition, which we have already discussed. Fourth one is improper toilet training. That is also we have discussed. And low socio-economical status. That part also we have seen. Because low socio-economical status, where the parents are very poor or not able to maintain the hygiene, okay, and they have some other economical problems and all, they are not able to give good care to the child, and the child rearing practices will be very poor, and that may lead to this problem. Sometimes because of mental subnormality also this is possible. So these are some of the most common etiological factors for primary nocturnal enuresis. Now we talk about secondary nocturnal enuresis. This is also called as a regressive type. What do you mean by secondary? Means child was dry for 6 months in between. Suppose a child has got nocturnal problem, and by the age of 4th year, suppose he got the control over the bladder and he started passing the urine in the toilet, and he used to get up in the night hours also to pass the urine, and later onwards suddenly he started this nocturnal enuresis. Now he is passing the urine in the bed. Okay, he is not getting up now. That means once he has attained the dryness, dry at night situation, and later again he started with the nocturnal enuresis, then this condition is called as secondary enuresis. Okay, so most of the time this occurs because of psychological stress. Okay, child is feeling some insecure feeling after birth of the younger sibling. This is one of the cause. Suppose a new kid come to the family, mother has got a new kid now in her hand. So now the first child may feel some insecurity because it is now deprived from the maternal care or maternal love and concern. So it may affect psychologically, and child may start with the nocturnal enuresis suddenly. It is already stopped, but now it is again started. Some family queries, familial discrepancies or familial problems, etc. Sometimes academic stress. Okay, child is going to the 5th standard, 6th standard, 7th standard, and there's some academic stress is there, and he is not understanding the mathematics, he is not understanding the science, then this may start. Okay, school failure does not like this classroom and teacher, etc. So sometimes academic failure or school failure. Okay, sometimes he may be worried of the teacher, he is afraid of teacher, or his friends are bullying him. So these are some of the psychological aspects which can lead to secondary enuresis. Enuresis once started may again re-begin. Now, apart from this, the other causes which may lead to secondary enuresis once stopped again is started. So this may be also because of UTI, urinary tract infection. It may lead to this. Then juvenile diabetes mellitus. This may lead to this because in diabetes mellitus juvenile, there is increased tendency of urination is always there. Then constipation. Okay, child is having constipation. Nobody is observing the constipation, and that is the cause. We will discuss one by one later. Neurological bladder. That is also a cause of secondary enuresis. Sleep disorders. Okay, or obstructive apneas. Sometimes obstructive apneas, some of the sleep disorders. Then urethral obstruction. Okay, any sort of urethral obstruction. Major motor seizure. Sometimes during the convulsions or seizure also, baby used to pass the urine. Okay, so involuntary passes urine. So that is also one of the cause of secondary enuresis. Ectopic ureter. That is, ureter is connected with the bladder at a wrong side. Ectopic bladder. So that may be also cause of the same. And in this condition, treatment depends upon the cause. If psychological factors are involved, you have to correct that. School factors are involved, that would correct. Sometimes there is a fear factor. Sometimes there may be insecurity. Sometimes there may be sibling rivalry. Okay, so sometimes he has got problem with the classroom. Sometimes he has got problems with the friends. Sometimes he is horrified by some of the movies, etc. Okay, TV serials, etc. So or horror movies, etc. he has seen, then it is started. So all such things, psychological aspects are possible in case of secondary enuresis. Same in the secondary enuresis, another set of the problem where some acquired problems are there, like UTI is there, JDM is there, then constipation is there, okay, neurological bladder is there. So now here there is no psychological involvement, but still child is having secondary type of enuresis. Now in all these conditions we have to correct the underlying cause. So this is also called as a regressive type. Secondary type of enuresis is also called as regressive type. Okay, so what are the most common causes which is encountered in the clinical practices? Resumption of the enuresis after 6 months of urinary continence. He has attained the urinary continence at least for 6 months. He was absolutely fine, but now again he started with the same problem. This is called as secondary enuresis, also called as regressive. First one is primary or persistent. Now, what is the most common causes? Again, if you list some of the most common clinically encountered causes for the secondary type of enuresis or regressive type of enuresis, they are precipitated by the stress. Any stress factors will go into stress. So suppose child has got the exam, then so he may start with enuresis. Okay, environmental events, sometimes death of some family members or some other horrible events around. So that may also lead to the same. Moving to the new home, the parents have changed the home and child is not get adjusted to the new environment and home and all, then also this may start. Okay, then marital conflicts, suppose there is problem with parents, they are always quarreling, or single mother and all those things, is also one of the problem. Birth of a sibling, most common cause. Birth of a sibling, naturally the maternal love is now diverted into two parts. Okay, so the first child will be get deprived and deprived of maternal care and affection. So that may lead to this problem. Then death of the family member, unexplained fear. Sometimes there will be unexplained fear. Okay, there is no cause, but still child will have problem in the darker areas or during the evening hours, etc. Okay, school changing, or again the medium of study also. Suddenly you are putting from the some Kannada medium to English medium or Tamil medium to English medium, child is not able to adjust there. So then this may induce the stress and this may start. Then friction with the friends. Okay, friends are not cooperative, friends are bullying him or making fun of him. So that may be the cause. Adjustment problems. That may also lead to secondary type of enuresis. Unfulfilled desires. Child wants something but the parents are not responding for it. Child want a playing article or child want some cycle and or something like that, but if parents are not giving it, okay, they are, because of many problems they are not giving it. So unfulfilled desires may also lead to this problem. Insecurity is another problem. Insecurity, different types of insecurity. Father and mother is not with them, some caretaker is there, father is coming only for 5 minutes, mother is also working lady. So these problems will be there. Okay, inferiority complex, this may also lead to the regressive type of nocturnal enuresis. So there are different types of inferiority complex. She may be very short in the school, she may be very long, she may be very long in the that means the most heighted girl in the school. Okay, she may be very short, or sometimes she's of black color, sometimes white color. So this type of inferiority complex will be always there. Or everybody is coming in bike and auto, she is coming by walking. So these such a small things are sufficient for the kids to induce a stress. Lack of love, concern in child, we have already explained. Child neglect and abuse, this is one more cause. Okay, this is also common in the low socio-economical status. Okay, low socio-economical status, this is quite common. Child neglect and as well as child abuse. Nowadays, one more thing is mobile addiction. Okay, mobile addiction is also one of the most common cause. Okay, so during the corona time, so we have given mobile to our kids and now the kids are not able to leave it. Okay, it's habituated for them. And as soon as you say something about this mobile and mobile usage, to say them to decrease the screen time, so now they are get irritated, and this may also lead to what you say, a regressive type of nocturnal enuresis. Bedwetting is a transitory and better. This type of regressive type of bedwetting or nocturnal enuresis is always got a good prognosis because we can identify the cause. Okay, it's all are treatable causes. All are treatable causes, so we can address that particular cause and we can treat it, and then the results are good. So secondary type or regressive type of enuresis is always having a very good result. Now these are some of the causes if you want to list out. Psychological enuresis, okay, the most commonly familial conflicts. Again, we are summarizing the things. Maladjustment, two strict parents, sometimes very strict parents are from the military, suppose army and all, so they want to follow the same rules and regulation in the home also. So child is so far very relaxed, and now the father is back from the army, and he is implementing all the rules of army in the home, and now the child is under frustration. Okay, so rejection sometime, then sibling rivalry, this is over. Then erratic handling of the problem by the parents further aggravate and increase the anxiety of the children. This is very important. Suppose the baby passes the urine at night because of some psychological problem or whatever causes. When the parents make it a very big issue, parents make it a very very big issue, and they tell this to everybody, and erratically it is handled. It is not handled with the patience. Okay, it's a very, and parents itself, they themselves, they think that this is a very big problem. Okay, then this creates anxiety and confusion in the children and further increase the problem because it further induces the stress. Okay, so parents should be educated to handle this problem very very carefully, coolly and calmly. Okay, this is not such a big problem. This is a treatable problem. If it is secondary, it is a treatable problem, so we can treat it. So we should not say anything in front of the children. Okay, whatever we have to discuss separately with the doctors and everything, and child should be given with all the confidence, that's all. And child is not doing it intentionally, it has got some problem. Okay, stress may be the problem or some other problems may be there, but we should try to correct it. And usually child, in case of secondary enuresis, is a very deep sleeper, or rather sound sleeper. You will also have a sound sleep. Okay, usually such children in sound sleep, they pass as a urine. Okay, so too late, too early or improper training by the parents regarding the bladder control is also one of the cause. Okay, even it is erratic toilet training is also one of the important cause for the primary enuresis. Similarly, in secondary enuresis also sometimes improper way of toilet training is one of the major cause. Okay, there are some physical factors like worm infestation, anatomical defect may also cause this type of problem. Now, what is the impact of the disease? Impact of the disease, primary, it may be primary or it may be secondary. The impact of the disease is psychological impact will be always more. Okay, so child will be feeling ashamed. And many times child is feeling insulted. And there will be bullying. Suppose if the parents are telling this news to everybody, neighbors and all those things, nearby people, then it will be spread like a fire, and everybody start asking the child, why you are doing so. Now child will be again under stress. Okay, it is feeling insulted, or it may lead to depression in the child. It may lead to introverted nature of the child. Okay, child don't want to go outside because if you go outside, everybody will ask, what is happening, what's happening, why you are doing so, you are such a big kid, you should not do like that. Okay, there will be a social withdrawal. This leads to social withdrawal. Then feeling of regretfulness. Child also desperately want to come out of this problem, and child is not doing it intentionally. So when everybody is asking and when the problem is becoming very big, so child will feel really regretful that because you don't want to give any trouble to the parents. Okay, but when parents are troubled or frustrated by this particular behavior of the child itself feels very much regretful. And sometimes there is unexplained fear will be there. So emotionally child may be punished. The risk of emotional and psychological abusement will be there. So these are the impact of the disease. Okay, many times parents may emotionally and psychologically abuse the child. Why you are doing so? It's so much problem, creating so much problem for me. Your younger one is not like that. Your big elder one is not like that. You only are doing like this. The neighbor's child is not doing this. Emotional and psychological abusement will be there. Okay, that is also one of the impact of the disease. And ultimately there will be reduced academic performance. Child will have reduced academic performances. So these are all the different impact of the disease. Now, this particular disease has been mentioned in Ayurveda. Okay, so now we come to the Ayurvedic part. Okay, Shayya mutra, it is mentioned in the name of Shayya mutra. Of course, there is no direct references anywhere in the Samhitas, but Sharangdara Samhita mentions one important shloka. Okay, that is Sharangdara Samhita Purvakanda, 7th shloka, 177, 7th chapter, 177 shloka. In the Tika it is told that Ratro Sapna Avasthayam Shayyagate Bale अक्षीण पूर्वकं मूत्रयति दोष प्रभावात्. अक्षीण मूत्रकं मूत्रयति पूर्वकं मूत्रयति दोष प्रभावात्. The word Shayya mutra denotes that by the influence of some of the doshic factors, unknowingly child passes the urine during the sleep at night. Okay, during sleep at night. The word meaning of Shayya mutra implies the wetting a bed with urine at night. Okay, this is from the Monier-Williams dictionary. So, what are the Nidanas according to Ayurveda? Neither of the Brihatrayis or the Lagutrayis had explained this etiopathogenesis. In this Sharangara Samhita also, it is the Tikakara who is giving this particular shloka. Sharangara is not directly giving this shloka. Sharangara mentioned Shayya mutra as one of the Balaroga. Okay, out of 22 Balarogas, Sharangara mentioned Shayya mutra also as one of the Balaroga, but no details of the disease is given. Okay, commenting on that Shayya mutra, the Tikakara says that Ratru Sapnavastayam Shayyagate Balehe Akshina Purvakam Mutrayati Dosha Prabhavat. This is the explanation for Shayya mutra. So with this, we finish the theoretical part of the Shayya mutra or nocturnal enuresis. Okay. In the next class, we will continue with the detailed pathogenesis and clinical implementation and treatment of a Shayya mutra. Thank you very much.